Thank you so much for inviting me to give this talk today. And so I'm hoping to, obviously talk about food additives. We'll cover what to know about them, as well as maybe some tips at the end about how to avoid them or reduce our exposure to them. So just as a bit of an outline for the talk, I'm going to review the history of food additives, regulation, how the FDA evaluates them. We'll talk a little bit about the dirty dozen of food additives and some of the current legislation that you've probably been hearing about in the media. Then we'll talk about, identifying food additives, reducing our exposure, and maybe, at the end, talking a little bit about maybe some other actions that we can take. So, food additives are defined as substances that are intentionally added to foods for a specific purpose. And usually, this is related to preservation, quality, taste, and texture or appeal. And these substances can be natural. So, thinking about things like salt, vinegars, herbs and spices, lemon juice, or like molds that are added to cheeses, as well as artificial substances. So thinking about man-made chemicals. And so there are thousands of these substances that are used in our foods and beverages. And though I'm not talking about it today, obviously there are, these chemicals that are also added to medications, as well as thinking about personal care products and cosmetics, obviously adding colors to cosmetics or different like lotions or other products that we may use. Okay, so why are food additives used? So as I mentioned, they can be used for preservation, for safety and freshness. So these are things that we might add to slow spoilage, bacteria contamination, or mold growth on a product, and also help with extension of shelf life, enhancement, so improving the taste, the color, all the different sensory qualities that we might expect when we're eating a food. So not just, thinking about what it tastes, but what it looks like. And then nutrient fortification. So thinking about the addition of vitamins, minerals, and other nutrients that might be added to products that improve their dietary intake. So an example of thinking about how folic acid is added to our grain products. And part of that is to improve intakes, particularly of women of reproductive age who are at risk of getting pregnant. And that's obviously to reduce the risk of neural tube defects. There's also, sometimes we add nutrients back when things have been lost during processing. So a lot of times this happens with grains. We might remove parts of a grain that might contain a lot of vitamins and minerals. And so we might want to put that back into the product after we've removed it, as well as maybe enhancing the nutritional quality. So thinking about something like milk, where we add vitamin D. So milk has a little bit of vitamin D in it naturally, and we tend to add vitamin D to fortify it. So I just made this slide to show, and there are many, many food additives, but going across the top, just thinking about some of these different properties that food additives might have, like antioxidants, food dyes, stabilizers or emulsifiers, sweeteners, and then thinking about maybe some other, anti-caking agents or acidity regulators. And then just, many different types of additives that you might see listed on ingredient labels that are added to foods for these purposes. So, the food additives, we've been using them for centuries. So you can look back in, any sort of by food historians, and you'll see that this is the addition of different substances to our foods has been practiced for centuries. Thinking as both ways to preserve foods. So, when they would have crops and want to save them for winter months, salting or smoking foods to preserve them, as well as enhancing their flavor. So there are instances, looking back in ancient China, where they burned paraffin wax to ripen fruit. Egyptians used saffron to color food, and Romans added this potassium and aluminum sulfate to make bread look whiter. But food additive use really started to increase dramatically during the Industrial Revolution. And so part of this was due to, this migration of people from rural to urban areas. There were tremendous advances in analytical chemistry as well as technology advances. So thinking about, ways of canning foods or refrigeration. And so this led to greater food processing, greater large scale food food production, as well as being able to transport food. And so during this time, due to all of these advances and obviously wanting to extend shelf life or cost effectiveness, there's an addition of numerous substances to our foods, particularly unnatural substances. And during this time, there was some concern about this intentional sort of adulteration with toxic substances. So, you might read about lead or arsenic being included in food dyes, or formaldehyde being used in meat and dairy as a preservation method, as well as stimulants being used in soft drinks. So in the early 1900s, and if you look back sort of over the history of sort of food additive legislation, particularly in the US, you see that starting in the early 1900s, there was more of an increasing public awareness, and efforts to want to pass food additive regulation. And so one of the big acts that was first passed around this was this Federal Food and Drug and Cosmetic Act. And so this act helped to expand the FDA, the Food and Drug Administration's authority to regulate food quality, and set legally enforceable food standards. And then the big sort of amendment to this was this 1958 Food Additives Amendment. So this amendment mandated that manufacturers ensure the safety of all new food additives that were being added into our food supply. Some of you may have read about the Delaney Clause. This has come up recently, and especially when talking about color additives and some of the red dyes. And so this clause was put in that prohibited additives shown to cause cancer in animals and humans. So if an additive was shown to cause cancer, then that in animals or in humans, that additive would not be allowed to be used in foods. It also created this generally recognized as safe category, which we'll be talking about a bit more. And so this allowed for ingredients that were either had a long history of being used without negative side effects, or that had a known safety, such as table salt, from having to undergo safety testing. And so this was originally, we'll talk about this, but this generally recognized as safe category was originally used to sort of save, to make sure that we're not, to sort of allow these foods that we already sort of considered as safe to not have to undergo further safety testing, and to allow, some of the FDA resources to be put more towards ensuring that any sort of new food additives were undergoing rigorous testing. And then lastly, there was this 1960 color additive amendment, which basically said that color additives are separate from food additives. So color additives had to be determined as safe before being marketed to consumers. So who regulates food additives? So at the international level, the Joint Food and Agricultural Organization of the UN, as well as the World Health Organization, has an expert committee on food additives. And so they evaluate the safety of food additives for internationally traded foods. So this applies to both natural and synthetic food additives, and they use, similarly to other risk assessment processes, they look at biochemical and toxicological assessments in animals, as well as evidence from observational studies in humans. And then on top of that, most countries, as I'm sure we're aware, have their own food safety regulatory boards. So a lot of times we hear about the European Food Safety Authority and the different food additives that they've banned that we haven't banned here. Canada obviously has their own. And as I mentioned, in the US, the FDA regulates food additives to ensure that they're safe, as well as they're used safely within our foods. So I just wanted to take a moment to talk about how we even assess risk. So risk is calculated sort of as accounting for the safety concern or the hazard of an ingredient, as well as the level of consumption. So, there might be things that we think of that pose a very small risk, unless we're exposed to in very large doses. And so an example would be apples, right? So apples, we know that their seeds contain a compound that break down into cyanide during digestion. But we also know that we would need to eat about 20 apples in a short period of time, and we'd have to eat the entire apple, so seeds and all, in order to become sick. And we also know that there are numerous health benefits that are associated with apples. So, so the point of this basically saying that we know we have to take into consideration what the risk is that something poses, the number of different risks, the number of different health risks that something might pose, and then thinking about the level of how much we would have to consume or how much we would have to be exposed to in order to have those health risks. And then also on top of that, taking into account, are there any benefits associated with this that we might want to weigh against the risks? So for food additives, they should undergo a full risk assessment. So again, this would be considering the different potential hazards that might be associated with it, the different exposure points, so the amount of exposures that we might have, any sort of benefits, as well as any other variables that might be considered for determining that final safety assessment. So normally there's this four-step process. So again, you're just going to identify the potential hazards associated with the ingredient. You're going to look at the dose response assessment, so examining how much of the ingredient you're exposed to and when that health risk occurs. You're going to think about the quantity. So with food ingredients in particular, we might think about how much do people normally eat in a sitting, or how much do people normally eat daily or on a weekly basis. So thinking about the ways that people might consume that food and the amount of the additive that they would be consuming. And also taking into account the different population characteristics. So maybe as a healthy adult, a person consuming that would be okay, but that risk might change, or the dose response might change if it's a small child or a pregnant person. And so the risk characterization is then going to combine all of this information to determine the overall risk associated with the ingredient. And then scientists can use that data to determine the highest level that an animal can be safely exposed to, and then calculate from that down the level that a human can be safely exposed to. And so normally, if you were to look up certain chemicals, I worked for a long time with environmental chemicals. People might be aware of like phthalates or phthalates or other things that or PFAS. So you often might see that the level that they calculate that is safe in humans, we're often exposed to a much lower dose than what they're deeming as being a safe level. So normally what we see is that we're having much lower exposure levels than what is where we might see health risks. So an additional consideration with this is the precautionary principle. So the precautionary principle says that we're morally bound to ensure that our actions will not cause significant harm, or that the benefits of our actions far outweigh the risks. So when this is applied to looking at food ingredient safety, if there's a scientific possibility that an ingredient could cause harm, but the risk assessments have not proved that that harm will occur, then we should avoid taking any action until we can scientifically prove safety or demonstrate that the benefits outweigh the risks. And so with the EU, when they're looking at ingredient safety, they include the precautionary principle when evaluating and doing their risk assessment, whereas in the US, we do not. So this is often why you might see differing food safety regulation between the US and other countries. So when the precautionary principle is combined with risk assessments for ingredient safety, the ingredient's not going to be approved if there is concern that it could cause harm. And in those cases, often there would need to be further research on that ingredient in order to prove that it doesn't cause harm, or there would just be the onus of trying to find a different ingredient, one that doesn't have that risk profile. So in the EU, ingredients are approved and regulated once the risk assessment and the precautionary principle demonstrate that the ingredient is safe. An ingredient will not be accepted if researchers or policymakers suspect that the ingredient could cause harm, even if they can't quantify how, when, in what form, or at what levels harm will occur. In the US, it's a little bit different. So all ingredients are approved and regulated based on the risk assessments, but the FDA evaluates food ingredient safety based on a standard of reasonable certainty of no harm for the proposed conditions that that ingredient is going to be used for. So rather than requiring proof of actual harm. So how does the FDA evaluate food additives? So the way it works is that new food additives, so any new additive that is not currently in the food supply that a manufacturer wants to include in foods that are marketed to consumers, they need to be approved by the FDA. As I mentioned, that the 1958 amendment had this basically made it so that ingredients that were considered generally recognized as safe were not considered as food additives and were exempt from this process. So with any new food additive, the food manufacturer is responsible for seeking FDA approval of that new additive by submitting a food additive petition. So the manufacturer has to provide the scientific evidence that the additive is safe for the ways it will be used, including the foods that it's going to be used in and the intended levels of use. The manufacturer has to demonstrate that there's a reasonable certainty of no harm. And then the FDA posts this information for public comment. So people can go in, review this information, and make a comment about it. The FDA will then evaluate this petition and all of this other data. And if they decide to approve that food additive, then they'll set regulations for the types of foods that it can be used in, the maximum amount that it can be used in those specific foods, as well as how that ingredient needs to be identified on food labels. But as I mentioned, there is this generally recognized as safe designation or category that doesn't apply, that basically separates out ingredients and makes them so that they are no longer considered food additives. So as I mentioned, the initial intention of this was that this would cover food ingredients that had a history of common use. So this would have been substances that were widely consumed in food before 1958, where their safety had been demonstrated, such as salt, vinegar, yeast, canola oil, as well as substances without this prior history, but that had been demonstrated as safe through scientific studies and evaluations. So although the FDA should be or must approve new food ingredients, any ingredients that can be designated as GRAS are exempt from this process. And so this is what has been, I mean, if you look at any sort of articles online or, in newspapers and in media talking about this, a lot of times they're talking now about this issue with food additives that are available in our food supply being related back to this generally recognized as safe loophole. So since 1997, the FDA has allowed the food industry to self-determine a new food ingredient safety and classify that ingredient as GRAS. So this means that manufacturers are not required to disclose the use of these new ingredients or their safety data, and manufacturers only have to voluntarily notify the FDA that they would like to include this ingredient or are including this ingredient in their foods, and they're saying that it's generally recognized as safe. However, they can so let's say they do voluntarily notify the FDA. They say, hey, we've got this new ingredient. We think it falls under this GRAS category. If the FDA even starts asking questions when they're reviewing the food manufacturer's safety data, the food manufacturer can still basically take it back, right? Say, okay, never mind. We're not going to notify you anymore about this. And they can still then go ahead with self-determining the ingredient as GRAS and putting it into our foods. And although the FDA does, so even when things are designated as GRAS and they're put into our food supply, although the FDA does have sort of a post-market review process, so they can continually review new data and revoke that GRAS designation that the food manufacturer had put on that ingredient, it rarely happens. So it has created a loophole for the food industry to bypass FDA safety review with many new food ingredients. And so the result is that there are ingredients that are added to our foods, which we really actually don't know the true safety data for, because it's not necessarily known to the FDA or known to the public. And so this does raise, concerns about the transparency as well as health risks that might be in our food supply. So this is just an overview of how these new food additives can enter the US food supply and what I just discussed. So basically in the green is what we would want to happen, right? So if there's any sort of new food additive that a food manufacturer wants to add to their foods, they would undergo this, they would submit the petition, as I mentioned, to the FDA. So it's this pre-market approval process. The FDA would conduct their review and safety assessment, and all of this information would be posted for public comment. And so if the FDA doesn't approve it or has more questions, then they can reject the petition, or the manufacturer can withdraw, or the FDA can approve it, and it's deemed as safe and it can go into our food supply. But as I mentioned, it's over here in the red, this generally recognized as safe category, where either the manufacturer can do this voluntary notice, and then if the FDA reviews it and they have no questions, they can still use the ingredient. Or, as I mentioned, if the FDA has more questions, the manufacturer can just withdraw their voluntary notice and say, okay, forget it, and still it gets into our food system. Or, as I mentioned, there's this sort of secret way where they don't actually even have to tell us. There doesn't even have to be a voluntary notice. The manufacturer can make their own determination, and it again gets into our food supply. So this is an example. This was by the Environmental Working Group. And so they looked at the number of food additive petitions. So that would be the way in the green, where the food manufacturer has the new additive and they submit a new food additive petition to the FDA versus the voluntary notice of saying, okay, FDA, we have this new ingredient and we think it's generally recognized as safe. And so what you can see is the food additive petitions are in the orange and the voluntary notices are in the blue. And so this is from 2000 to 2021. So you could see that the majority of new food ingredients that are being put into the food supply are being used through more of this voluntary GRAS notifications rather than these food additive petitions. So 99% were added through this GRAS loophole. But as I mentioned, there's that also separate sort of secret GRAS where they don't have to even right? It's voluntary. So they don't have to actually notify the FDA. So it's been estimated there might be at least 1,000 more ingredients that are in our food supply that have been added by food manufacturers using this loophole without even any notice to the FDA. Okay. So, obviously, as I mentioned, there are many, many different types of food additives that, looking on any sort of ingredient list for foods that you're going to see, and there are lots of them. So, I did focus on this dirty dozen of food additives, which is based on a list created by the Environmental Working Group. And so you can see some of them might be familiar, especially obviously red dyes or the different synthetic food dyes and color additives. So looking at this list, though there are several of them that have been listed as probably or possibly carcinogenic based on the International Agency of Research on Cancer on their classifications, on IARC classifications. Almost all of them are currently banned or have restricted use in the EU. But only, oh, sorry, this should be red here, but only 2 of them are currently banned by the FDA. So the FDA recently banned brominated vegetable oil, and that was in, I believe, 2024. And then red 3, if people have been reading the news, that was recently banned in January of 2025. There are also pending bans in the US for some of these other chemicals as well. So looking at these, many of these within the US, but this is not on the national level, but on more of the state level. And so again, I think what you'll probably see in the media is that we've been seeing states rather than at the national level, we've been seeing states take over some of this regulation and legislation on a state level for trying to move the needle on removing some of these food additives that we feel like especially looking at, what's been banned in the EU, and especially looking at a lot of the data that's come out, that we should probably remove these food additives from our food supply. So both California and West Virginia seem to be some of the more progressive states. So California has been banned Red 3, potassium bromate, brominated vegetable oil, as well as propylparaben from the food supply in California. So this is effective in January 2027. So foods can't be sold in California if they contain these food additives. And they also ban synthetic dyes from school foods. Similarly, West Virginia passed a ban, which is going to be effective in January 2028, banning the synthetic dyes, BHA, as well as propylparaben. And then lastly, New York does have this Food Safety and Disclosure Act. And so it is proposing to ban some of these synthetic, so Red 3, potassium bromate, and some of these others from food sold in New York, as well as banning synthetic dyes from all public schools. This New York Act has also proposes to close this grass loophole that I was talking about. So it's going to require food companies to publicly disclose the safety data and the information that they're using for all of their ingredients, even if they designate that ingredient as generally recognized as safe. So making sure that everybody is aware, both public and FDA, about what's actually in their foods. And there are other states that have joined in proposing restrictions. A lot of it focuses on school foods and what's available to kids. And there's also, at times when they don't really want to propose restrictions, they will have legislation, which is a little bit less helpful, but at least, providing some level of information to people in terms of warning labels on the foods that contain them. And so, some of what we've seen in these state bans, I think it has been what's been helpful in moving some of this federal legislation. So in 2024, the FDA announced that they were going to start enhancing their post-market review. So looking at these chemicals or food additives that are already in the food supply to better identify ones that might pose potential public health risk. And so maybe going back and saying, okay, maybe these are not safe and need to be removed. So in 2024, they conducted a review of 21 chemicals. I believe only 4 of these chemicals were actually food additives. But from this review, they ended up banning that brominated vegetable oil, which I mentioned, as well as Red 3. Then in January 2025, the FDA announced banning Red 3 from foods, beverages, and drugs. And then beginning in 2027, companies have to start removing the dyes from products, as well as any sort of imported food that's sold in the US. And then in April 2025, they actually extended this. So beyond Red 3, the FDA announced phasing out all synthetic dyes. They're actually proposing to move it up. I guess we'll see if this sticks, but to 2026. However, titanium dioxide, which is something that people might be aware of, and is also used as a color additive, has not yet been included on that list. So I did want to cover just what titanium dioxide is, because it does come up, especially when talking about these synthetic dyes and wanting them removed, and how titanium dioxide still isn't really considered as part of those. So this is a common color additive, and basically you're going to see it in anything that is food product that is white. It's also used in other white things like sunscreens, paints, as cosmetics. And so there has been concern about these nanoparticles sort of accumulating in the body, and that it has been related to DNA damage or other adverse health effects. And so this titanium dioxide is banned in the EU, but that international council that I mentioned does conclude that it's safe in the amounts that it's used in foods, and the FDA does continue to allow its use. So, this is something that has come up, and I think if to be aware of it, and to know also that titanium dioxide is not, it does not have to be specifically listed on an ingredient list. So if you see artificial color or color added and the food is white, it most likely contains titanium dioxide. As I mentioned, the other synthetic food dyes are the ones that we think about in terms of red, yellow, blue, green. These have all been, hopefully will be removed from our food supply within the next year. And so these were just made to make foods more attractive. So there is no other property that these food dyes have besides improving the look of our foods. And so these are used in thousands of foods. Red 40 has been the most common. And I'm sure that, you've probably read about that, there is evidence that these have been connected to numerous health effects, particularly in at-risk populations. So, neurobehavioral outcomes in kids, allergic and hypersensitivity reactions, and some evidence of them being carcinogenic. And so just to be aware that because we're going to be phasing out these synthetic dyes, you will start to see that natural food dyes are going to take their place. So natural food dyes actually don't need to undergo FDA approval because they're derived from vegetables, minerals, or animals. But the FDA does review them. And so currently, because there's this push to phase out, obviously, all of these synthetic dyes, the FDA is fast tracking natural food dyes. So to be aware that, they are more expensive and they are often less stable and can degrade in certain situations like light and heat. And so, they still obviously can cause allergic reactions, but they're clearly much safer than the synthetic dyes. So, be on the lookout for on food labels, looking for natural colors or other sort of recognizable ingredients, like you might recognize beta carotene or turmeric, beetroot. So these are all, I think, different types of natural food additives that you'll see particularly for coloring foods. Okay, so how can we identify food additives? So, I am a nutrition person by training, and so I do think nutrition is very important. So I did want to just say that we want to always read all of the food labels and as well as the ingredient information. So it's important, obviously, to look at the nutrition facts. We see nutrition facts. So this type of label is what's often seen on foods where there might be more than one serving in the container, but it's often consumed potentially in one sitting. So like a pint of ice cream. So that's why you might see different food labels. So ones where there's definitely the chance that somebody might eat it in one sitting, they tend to show per serving and then per container, versus, if there's more concrete servings in a package, then they'll show this type of label. But yes, obviously, I think that it's very important to always be cognizant of, the fat, the fiber, added sugars, protein, sodium, and those types of things. So when we look, though, at the ingredient label, the FDA requires that all ingredients must be listed on the food label. So there's very few exemptions. So you're often going to see that they're going to list all of the names, particularly color additives. As I mentioned, some of them, like titanium dioxide, is not going to be listed as titanium dioxide. It is allowed to be listed as an artificial color. So you might want to look out for things like artificial spices or colors or flavors that might hint at some sort of more chemical food additive being in the food. Ingredients are always listed in greatest to lowest amounts. So generally, the first three ingredients are representing the largest proportion of what you're eating. And most of the food additives are going to be found towards the end because they're often used in small amounts. So this is just an example of comparing blueberry yogurt to plain yogurt. And you can see that, the blueberry yogurt has some more ingredients in it compared to what we're seeing with the plain yogurt. And so in general, I think a good, to use, like, to look at how many ingredients are are on the ingredient list, and try to limit to see if you can get fewer ingredients. It's probably a little bit healthier compared to something that has a long list. But again, this is something where they have vitamin A and vitamin D added. So how can we identify food additives? So as I said, we can always look for labeling on the packages. They might indicate, no parabens or paraben-free or nitrate-free. You can look for the colors, which hopefully they're phasing out. But currently, you could see blue too. Also identifying other clues. So as I mentioned, you might see just artificial colors or color added or artificial color added. So a lot of times this is still going to hint that there's some sort of chemical in it. And I really do think that, when in doubt, try to look it up, because a lot of times there may be vitamins added that have sort of a name that you might not be familiar with. So example, you might see riboflavin on it, and that's vitamin B2, or, ascorbic acid is vitamin C. So I think it's important to also, if you don't know something, to look it up, because it could be something that is not as safe. So, just I think, again, this is sort of highlighting just that we do need to look at the ingredient list, because looks can be deceiving. So, you might not expect. So all of these products have colors added to them. And so we might not think necessarily that smoked salmon salad has, red 3 added to it, or, the sweet relish has a green color added to it as well. So, it's important to look at the ingredients and maybe not make a snap decision just based on the actual product. I did want to make a comment about nitrates and nitrites, because I think this is also another food additive that gets a lot of attention. So nitrates, they are found naturally in leafy greens and vegetables. So there's a whole range of vegetables that contain these. But we also see it, the synthetic form, added to cured meats as preservatives. So this is often why this is one reason why you hear not to eat deli meats or cured meats, because of this issue of having sodium nitrates added to them. So when we consume nitrates, they are converted to nitric oxide. And this is associated with many health benefits. You can actually buy nitric oxide supplements. And so there's many functions associated with nitric oxide that, associated with promoting heart health. But at the same time, we know that they have been associated with a cancer risk. And so the reason why is it depends on the source. So when you're cooking, so when nitrates are consumed with meat, and they're being cooked at high temperatures and they're being consumed with proteins and meat, there is a conversion that goes on in the body during digestion to nitrosamines, and that is the carcinogenic compound. However, when you're eating them through vegetables, so often these are with lower cooking temperatures, there's antioxidants and other beneficial nutrients within the vegetables, as well as low protein content within the vegetables. This inhibits this conversion to nitrosamines, and you don't see the same effect. So it's important to be aware that if you are concerned about nitrates and you are wanting to reduce your exposure to them, we don't want you to reduce your exposure in terms of eating vegetables, but we do want to be careful with some of these meats. And so one of the things that has come up is that you'll see sort of these misleading labels where they'll be marked as uncured or no nitrates added. But then when you look, it will have something on the label where it'll say that there was sort of natural curing agents like celery powder, instead of seeing sodium nitrate. And so the issue is that even though the source is the same, or even though the source is different, right? So it's no longer synthetic nitrates, it might be it's coming from a natural source, such as celery. The issue is more that what it's being consumed with. And so in this case, because it's being consumed with these meats, it's more problematic. So just know that even if it says something like no nitrates added, it still has the same sort of health effects. Okay, so how can we reduce our exposure to food additives? So, I sure people maybe sometimes roll their eyes at this part of it, of these talks, because I think, the message tends to always be prioritizing consuming natural whole foods and beverages, particularly water, obviously, and limiting consumption of ultra processed foods. And so I just wanted to make, just to quickly discuss ultra processed foods, because they are in the news a lot. And and there's a lot of talk of it, I think, on the federal level of thinking about how, they might try to limit consumption or of ultra processed foods, even on thinking about different like food assistance programs. And so, I think when we think about this issue of food additives, and what health concerns we might have with the specific chemicals that are being added to our foods, I think we also have to think about the source and the foods that they're coming from. And so there is sort of this debate about, how it's also plausible that, the main health concern is not necessarily just consumption of these food additives that have been added to our foods, but also thinking about the foods that contain them and the nutritional value of those foods themselves. So when we talk about ultra-processed foods, it has been based on this NOVA food classification system. And so this is the system that most of the researchers use when you might hear about studies talking about ultra-processed foods. And so this NOVA classification system has 4 groups. So in the first group, they have these unprocessed or minimally processed foods. So these are foods that either have been directly obtained from plants or animals with no alterations, or that have been sort of minimally altered. So they can be frozen, they can be pasteurized, they can be milled or ground, but they don't have much or anything added to them. So examples you can see here are grains, natural cut or frozen or dried fruits and vegetables, beans, plain yogurt, and fresh and frozen meat, and poultry or eggs. The next classification is just these processed culinary ingredients. So these are ingredients that are extracted from natural foods, and they may contain additives or, to preserve shelf life or prevent bacterial growth. But these are foods that we use normally during cooking. So these are things like salt and sugar and oils and butter that are going to be added when we're making some of those minimally processed foods, right? Or when we're preparing them. So this is where I think it gets a little confusing. So processed foods, we still think can be part of a healthy diet. So processed foods are taking those minimally processed or natural foods, adding some of these culinary ingredients that we often do in many of our cultures to prepare different types of meals and dishes. And we still can consider these healthy. So these are examples like a minimally processed bread that you might make at home, cheeses, canned fruits, canned vegetables, fishes, and fermented alcoholic beverages. So we often think of these processed foods as being part of, that can be definitely part of a healthy diet. Where it gets concerning is these ultra-processed foods. So these are these industrial formulations of ingredients that require multiple manufacturing techniques and processes. And these are the ones that are also going to, contain a lot of food derivatives and a lot of the enhanced flavors, all of the sort of chemicals that we've been talking about today. And so you can think about these in candies, highly processed breads, sugar-sweetened beverages, store-bought, a lot of store-bought like cakes and ice creams, as well as, flavored cereals, and things like that. So it's important to know that, I understand as being a nutrition professional that we live in a certain food environment, and understanding that many of our foods are processed. So 70% of our food supply is made up of ultra-processed foods. And when they do studies, about 54% of our calories consumed from home are consumed at home are consumed from ultra-processed foods. And obviously, when we go away from home, that even increases. So about 67% of the calories of the average American that are consumed away from home are often coming from ultra-processed foods. And so, as I mentioned, ultra-processed foods, I think, I don't want to make it, I don't think we can make it too complicated. And that's why I think it's also important, as I mentioned, of looking at the actual nutrition label and identifying, some of the things that these foods have in them, like very high added sugars, sodium, saturated fat, low fiber, low protein. And often they don't contain a lot of vitamins or minerals either. And so, we want to stay away from these foods because these foods in general have been associated with a range of poor outcomes, which has been, a lot of talk in I think media and messages coming out of the federal government now. But I think it's important to realize that, not all ultra processed foods are created equally. And research does show that some ultra processed foods, especially those that are related to fruits and vegetables and grains and dairy, can support a healthy diet. So thinking about, whole wheat breads that you might buy at the store, tortillas, liquid eggs, some flavored yogurts, as long as they don't have too much added sugar in them, fortified soy milks, as well as other plant-based milks, as well as maybe, some chickens or meats that you might get that might already have prepared seasoning on them. So these can still be considered part of a healthy diet. We also might want to, look for healthier varieties of ultra processed foods. So, there are food brands and food stores that are less likely to contain synthetic dyes or other food additives. So, Trader Joe's and Whole Foods. You might want to buy organic when possible, because organic foods are usually going to be free of synthetic dyes. And obviously, with fruits and vegetables, they're less likely to contain pesticides. But you can also look for alternative foods that, when you're looking on the label, contain fewer additives or don't contain any at all. Um, so, I gave these examples here of looking at something like, okay, if I want a bowl of cereal and I really, Fruit Loops is what's calling for me, there might be, there are examples that you might be able to buy that when comparing the ingredient list, you can see offer sort of a healthy alternative. So with Fruit Loops containing a lot of these different food additive and colors, you can see that here, in these Fruitful O's, they have more of the natural food dyes, or something like a Three Wishes, which, has, again, a shorter ingredient list. Again, thinking about something like, if you want Doritos, thinking about there might be healthier options in terms, at least, looking at the ingredient list, like Sun Chips or these Late July nacho chips. And then lastly, thinking about like chocolate chip cookies. Again, these are all going to qualify as being ultra processed foods, but there definitely are alternatives that I think would be healthier, and you can look at the ingredient list and sort of and be able to figure this out easily. Lastly, so M&Ms similarly. We can make and prepare our own foods. Obviously, that's the best way to sort of control what's going, what you're consuming. Because obviously it is hard to get information when you're buying, prepared foods or when dining at restaurants. So thinking about meal planning, organizing shopping lists ahead of time, trying simple recipes that all might sort of lower the burden on, preparing your own foods. But believe me, as somebody who doesn't really enjoy cooking, I understand that, this is not always possible, but it is helpful in definitely trying to reduce some of your exposure to these things and controlling what you consume. Lastly, I just wanted to talk about these online resources. So you can look up, there's a lot of online resources and good ones. The Environmental Working Group has some great lists in terms of, they have food scores database, they have apps, they have personal care product databases. And so you can look things up and see how they rate them and look at what might be concerns in them. Similarly, the Center for Science and Public Interest also has a chemical cuisine database that rates food additives. There's also Yuka. I know RFK brought it up. There was also an article in the New York Times about it recently. I do think, so it is a free mobile app. You can scan the barcodes. I do think it might be helpful for, helping you identify additives that might be in a food and trying to find, replacement or alternative options for those foods. But, there was in the New York Times article, they did discuss Yuka also does rate foods on, calorie levels and things. So they were putting like warnings on nuts and whatnot. So, I think some of these apps that are going to be out there and that are going to be made for these purposes can be helpful, in terms of just looking at, what the ingredients are and what you might want to be aware of. But I think also knowing that, some of them might take it a bit too far, I think, in terms of, we obviously think nuts are healthy. And so, no, you don't want to eat, 10 cups of nuts a day. However, I don't want to ever have people feeling like they shouldn't eat nuts because it has this yellow score on a Yuka app due to its calorie content. So I think being mindful of all of these different types of apps and the informations that they, using the information to make your decisions, but not not relying totally on them for making all of your decisions. And then lastly, I just wanted to, say that, thinking about other things we can do in terms of checking ingredients on cosmetics and hair, household cleaning items and personal care items, avoiding plastics, using glass containers, trying to use natural cleaners and avoiding toxic chemicals. Not all pesticides are going to be removed with washing fruits and vegetables, though, there is some evidence that it does help in certain cases. And there are obviously lists that you can look at in terms of, pesticide exposure, if that's something that you're concerned about, and certain foods that rank better on those lists, and certain fruits and vegetables that you might be better off buying the organic, spending the extra money to buy organic, and then others that you could buy the conventional varieties of, as well as, obviously protecting yourself from sun exposure, et cetera. So that's it. I know I talked for the full 50 minutes and it was a long one, but thank you so much. I'll be honest, my understanding is that I don't know if it's enforced, but it should be. So my understanding is that, they are required to put these ingredients on the food labels, or on the ingredient labels, so yeah, I mean, I guess I don't know how well that is regulated, that if there's, an omission of an ingredient, but, my understanding is, obviously things will go under, they're not listing the specific ingredients when they say flavors added or spices added or colors added, obviously. So my understanding, there are sometimes proprietary ingredients that can fall under those classifications, but, yes, but I mean, I assume that they are accurate, I would say. But I'm sorry, I don't know exactly the enforcement of, people checking to make sure that food manufacturers are definitely listing all of their ingredients. So okay, so this might have been a little confusing. So because I see there's another question about not being clear on the nitrate issue. So nitrates can be naturally found in foods. And then there is synthetic nitrates. So you might see sodium nitrate or sodium nitrite, and that is a man-made version that is added to meats. So that's what you've heard. That's when we've heard about, avoiding deli meats and cured meats based on that sodium nitrate being added. And so the issue about it is that it itself, when it's converted in the body to nitric oxide, there are health benefits to that. And so we are not concerned about consuming nitrates through vegetables and natural sources. The issue is that when they're consumed with meat, the protein level, the way we normally prepare meats at very high temperatures, when that's metabolized in the body, it's that process that converts it to nitrosamines, which are a carcinogenic compound and have been linked to being carcinogenic. So that is the issue with just consuming nitrates as part of, a cured meat or a deli meat. So I believe, the food manufacturers have removed sodium nitrate, and what you might see on a package is naturally occurring nitrates from celery powder, celery salt. So the issue is that still would have the same effect in the body because it's based on the metabolism of the nitrates and how they're being consumed. So it's still being consumed in that meat product. The meat product is still probably being, at high temperatures, et cetera. And so that's the issue. So we are, so that's the issue with it. So that this sort of no nitrates added, the nitrate free, and then they'll put that asterisk with the celery, that still does have the same effect in the body. I hope that makes sense. But we're fine with nitrates if they're in vegetables. I don't think so, because I think, I wish I knew more about this topic because my guess is, there's a lot on, like if you go to another country and you pick up, I'm making this up right now, but you pick up Fruit Loops there, that you will see different ingredients compared to what you might see when you pick up a box of Fruit Loops in the US. And my understanding is that's because there's different regulation there on what food ingredients are allowed. And so manufacturers have changed their ingredient list to match what is allowed in those countries. So you might see, if you go somewhere in Europe and you pick up something, you might say, oh, this looks completely different or somewhat different from what I've seen in the US. And so that's the reason why. So my thought on this would be that depending on where the food is made, they might manufacture it for the rules for that specific country, and they might change it when it comes to the US, or they can change it when it comes to the US and put in other ingredients because the US allows that. They're not left off the ingredient list. It's that they don't have to go through the FDA approval. So the FDA allows companies or food manufacturers um, to basically notify the FDA that this ingredient is considered generally recognized as safe, and then they can put it into the food without it having to go through that new food petition, that pre-market approval process of the FDA. So all of these food ingredients are going to be listed pretty much on the label. As I said, there might be that issue with like flavors, or, you also see it in like cosmetic products. If you see like uh scents, things that are added to make it fragrances, like there could be a number of chemicals that are included under fragrances, but the rule is they just have to be listed on the label as fragrances. So it's similar to that, but all of the ingredients should be listed somewhere there, is my understanding.